we kick you off with this story. A new machine is keeping a boy's heart beating. Doctors at Riley Children's Hospital are thinking outside the box to give him a chance at life. News 8's Danielle Zulkowski has a story of how one doctor went above and beyond for his patient.
Dr. Mark Turrentine is a man known for putting the tiniest hearts back together as a pediatric cardiothoracic surgeon, and he has a special relationship with one of the smallest.
Dr. T has a very special place in our heart. Junior and Dr. Turrentine have a very special bond.
Junior is only 2.5 years old. He is alive in large part because of Dr. Turrentine, the surgeon that implanted his Berlin heart after his transplanted heart started to fail. He received that heart as a baby due to congenital heart defects.
It's a ventricular assist device called a Berlin heart. It works as an external pumping mechanism for his right and left ventricle to serve as his heart to help perfuse the rest of his organs and his body.
He lives as normal of a life as possible for a toddler that is tied to a machine 24 hours a day. He can go on walks during the day, but the machine can only be unplugged for about 30 minutes at a time.
He is a typical 2.5-year-old. He is very busy and he wants to play, and unfortunately right now he's tied to the bed with all of the lines.
Without the Berlin heart, Junior would likely not live long enough to get another heart transplant.
There really wasn't an option. So children would be supported on medication, and they may or may not make it to transplant.
It was heartbreaking, but with the support of family and our faith, it really has helped us carry through and keep us strong, because you just never know how long your stay will be here when you're waiting for a heart transplant. Could be 6 weeks, could be 6 months.
These devices received FDA approval in large part because of Dr. Turrentine. He was the first doctor in Indiana and the second in North America to use a Berlin heart.
The FDA gave us emergency use authorization. That was the first implant of an infant in North America. And before too long, there was such a demand for it, it led to the FDA approving a trial, and then that was completed in the FDA.
Approval from the FDA in 2011 after that clinical trial. A Riley Children's Hospital patient named Bailey Hunsberger testified to help get it approved. Riley Children's Hospital is the only hospital in Indiana to use this machine. There are about 20 patients currently using the device. Danielle Zulkowski, Wish TV, wishtv.com, and follow us on Facebook.